Our next speaker is Sonya McDowall. And Sonya McDowall is a PhD student from La Trobe University. Her diverse background in human and animal healthcare includes experience in the UK within the NHS and social care, focused on innovative community healthcare through multidisciplinary partnerships, as well as veterinary experience within Australia. In 2019, Sonya graduated with a Bachelor of Vet Technology from Charles Sturt, and in 2020 she attained honours in Animal Science from the University of Adelaide. She's also a graduate of the Australian Institute of Company Directors. Sonya is currently studying an MBA and lectures within the University of Adelaide School of Animal and Veterinary Science. So we now welcome Sonya McDowall, who is speaking on a framework for companion animal welfare, exploring social determinants of health to influence relinquishment outcomes. Welcome, Sonya.
Okay, a little bit nervous, haven't done this before, so we'll just see how we go. But first of all, I'd just like to say a huge thank you to everyone here today. The work you're all doing is absolutely amazing, and the interesting part about a lot of the presentations which I've seen so far is that almost all of them have touched on social determinants in either a small way or quite a significant way and of health. And I'm hoping that going through this proposed framework today will help you all all with an underlining provision that will enable you to demonstrate the positive outcomes that you're all working towards or achieving to your stakeholders. Okay, so I'd like to start with, I begin to acknowledge the traditional custodians of the land in which we meet today and pay my respect to the elders past and present, and extend that respect to Aboriginal and Torres Strait Islander people here today. So, something's gone wrong with my slides up there. We've got a little bit of language. Okay, so not sure what's happened. Might be the joys of having a Mac. But what we know is that we're all in a period of dealing with some quite challenging times within our shelters. We've got cost of living crisis, rental challenges for all of our lovely pets, and that is having a severe impact on what we're able to deliver. So the social determinants are not new. They've been around since the 1980s, and in the early 2000s, the World Health Organization provided a conceptual framework for action on social determinants of health, and it has subsequently led to the World Health Organization identifying the role of social determinants as the concept to tackle social, physical, and economic conditions in society that impact upon health. And traditionally, in human health, we use them quite a lot. So social determinants of health are conditions in which people are born, grow, live, work, and age that affect their health and well-being. These factors are often beyond the individual's control and can significantly impact on their overall health. Here are the five main areas of which focus on improving population health and well-being, and it identifies several key domains relating to social determinants of health. And these are education, which links back to knowledge, skills, influence and employment opportunities; healthcare, the type of healthcare services and access available to these services and influences the health outcome for people; the neighbourhood where people live, access to parks, availability of fresh foods, etc. And then we've got social and communities that foster a sense of belonging and social cohesion, which contribute to healthier outcomes. And then economic, so one we all know pretty well, how financially secure people are, such as employment, income, debt, and expense. And all these social determinants are interconnected and have an influence on our lives. So social determinants have been well used in public health for some time and often a driver behind education campaigns. And what we see here, these are some of the education campaigns that are linked back to these social determinants, which we often have all seen. So we've got Quit Smoking. For those of us who have been around since the 1980s, you might know about Life Be In It, the wellness campaign. slip, slop and slap, which is now slide and shade, etc. It's been growing on. COVID, which we've all recently been through. And in the far right corner, your far right corner, is the Grim Reaper campaign, which links back to HIV and AIDS back in the 1980s. So I'm going to use the Grim Reaper campaign from the 1980s because I'm sure that you've all heard enough about COVID over the last few years, so I thought we'd do something a little bit different. And if we take this HIV and AIDS campaign back in the 1980s, the Grim Reaper campaign was aimed at educating the public about HIV transmission, prevention, and the importance of safe sex. So looking at those areas which I highlighted before in that round circle, we have the campaign looked at access to free testing and treatment, community involvement by fostering social support networks and advocating for policy changes and providing outreach services to vulnerable populations. It looked at being able to provide services regardless of someone's ability to pay. And it reduced the stigma and discrimination against those living with HIV and AIDS at the time. So, social determinants have been reported to be 80% responsible for health outcomes within the human population. But by integrating the social determinants into animal welfare, it's anticipated that improvements in animal welfare outcomes could also be achieved. And furthermore, this has not been done anywhere else before, so it's sort of a first here in Australia at the moment. So, okay, we've talked about human health, but what does it actually mean for animal welfare? So how do these social determinants of health apply in animal welfare? So there's been a lot of research done which link back to different sections of all these social determinants of health, and they haven't collectively all brought it all together. So, for example, if we look at the healthcare area of the social determinants circle, there's been research that shows people delay access to healthcare as a result of their pets. Medical conditions that people may have an impact on the animal welfare. In the community, 18 to 48% of DV survivors with pets report delay entering a domestic violence shelter, and we've seen that across several presentations already this morning. Animal shelter intake is higher in areas of low socio-economic status, and the cost of care is also a barrier for a lot of people. And then we've got higher education. Attainment has had lower straight intake at animal shelters, so those that have a higher education and live in more affluent areas, normally a lower intake. And then challenges to secure housing, which we're all very aware of at the moment with the current rental crisis. And then areas of high crime rate linked to increased animal abuse. So what have we actually done here? So we've tried to take social determinants and a model that we're all working within, which is, the 5 domains of animal welfare, and bring that all together into one framework, which hopefully we can use. Now, we'll just warn you, this framework, when it comes up, it might be a little bit overwhelming and there's a lot of information, but we will go through a scenario and try and work through it to see how it might actually apply to us. So this is what we've put together as a bit of a framework as to how we might apply social determinants to help us work towards reducing the number of animals that are relinquished to shelters. To your left are the human factors, okay? So they're the factors that we talk about at the moment in social determinants that relate to the humans. But the bits in blue are where the animals start to become involved. So in the middle we've got the animal guardian, which is the animal's owner, and the influences that the social determinants might have on the animal owner. And then the actual potential negative impacts on the animal at the end here. And then the purple parts relate to how that links back to the 5 domains of animal welfare. And if you're looking at it from a point of view of preventative services, which Vincent talked about this morning and Mike spoke about yesterday, is that this bit here is the point at which a preventative provision needs to start, okay, to then influence the remaining framework. So this is Dashi and Lockie, and my two fur babies. And I'm just going to talk through a scenario. It's not one I've experienced. So the end result for Dashi and Lockie, they're still very much living with me and still very much my little fur babies. But it's something I've heard also, I think Home to Home touched on a similar scenario when they talked about Milo. So we'll just talk it through to be able to show how this framework may be utilised. So off we go. So Dashi, Lockie and myself, we have been living in a rental property for 6 years, and everything's been fine. They've got a lovely garden to play in. They go outside, they go to the park, and everything's been no problem. But our landlord decided to sell. So which means we now have to find a new place to live, and we know how challenging that is for people at the moment. So we have to move further out, because the costs have gone up, and which means it now takes me longer to get to work. We then have to, this in turn then impacts on the increased cost of getting to work. Puts the cost of housing, it's still higher than what I used to pay, but because that's gone up everywhere. And overall, my overall expenses have increased. So, and due to having to move further away, I've had to move away from my social support, friends, families, and so forth, so I don't have my community connections anymore. And then this leads to my dogs not living in an area we're used to. We don't have access to animal care options because we're living in a different area that doesn't provide those provisions and parks and so forth. And we are now further away from our regular vet and the only vet we've ever used. So our relationship with others has gone, and Dashi and Lockie don't have their fur friends that they used to play with regularly at the park. And also too, they're no longer seeing family and friends as much as they used to, so people that they have known all their lives and built those relationships with, and that they also love. And then also due to having to travel further away from work, I'm away from the house longer because it takes me longer now to get to work, so I'm away longer throughout the day. And therefore, it's impacting on the time that I have to spend with Lockie and Dashi, and ensure their enrichment and playtimes. It's just not happening because I'm absolutely knackered. So this then has resulted in Lockie and Dashi not getting enough exercise, and we don't feel safe in our new neighbourhood, so we don't go out walking as much as we used to because we don't know it that well. And of course, going to the vet takes a little bit longer, and Dashi's not a fan of going for a ride in the car either. So therefore, Dashi and Lockie are not having a great quality of life, and this has resulted in them engaging in some negative behaviours, barking all day, destroying household items such as furniture. The neighbours have also started to complain about the barking during the day, and which is resulting in not able to giving them the time they need. We're now getting warnings about the dogs, and basically the situation has come to a head where it's either the dogs or a roof over my head. And therefore, as a result of that, in the increased costs, I reluctantly relinquished Dashi and Lockie to a shelter. So what this shows is, and there's lines going everywhere here, is that how interconnected these social determinants are and the influence that they actually start to have on our companion animals. And, as a result of having to give up my pets, my mental health and wellness also starts to deteriorate. But then if we start to look at the stories of two tales, which I'd like to introduce you to, Mocha and Patch, we start to explore what this looks like for the actual companion animal. And each one of these lines actually links back to an individual social determinant. So we've got Patch and Mocha. So Patch is doing really, really well, and Mocha not so well. And Patch is going to training classes, and Mocha runs around all day and barks. Patch has regular walks and plays with furry friends, and Mocha's guardians work long hours. Patch has a nice warm house and is able to sleep in a kennel, comfortable bed, toys to play with, but Mocha, because of the rental agreement, has to remain outside. Patch goes to the vet, has up-to-date vaccinations, and Mocha's guardians didn't get the extra shift they were hoping to get that week to be able to afford the vaccinations for him. Patch becomes unwell, and Mocha becomes, they both become unwell, but Mocha had a little bit more trouble getting to the vet because of transport options. But Patch is able to get there, able to get the medication and so forth, and Patch recovers. Mocha becomes a little bit more unwell because it's becoming a bit more difficult to get to the vet, and so the question then becomes what happens to Mocha. So what does this actually all mean in the grand scheme of things is that if we do a collaborative, and which we've talked about a lot over the last day or so, the communication and collaborative and integrated working with our stakeholders, if we start speaking a language that some of our human stakeholders understand, we'll hopefully then be able to get that better engagement with our multidisciplinary working. And if through multidisciplinary working, because traditionally human services are over here and animal services are over here, and we don't bring them together because whatever reason we're not quite there yet. And often I find it too, it's about how we communicate with each other and speaking the same language across both. Because I often find that sometimes I'm speaking human language when I'm dealing with the health professionals, and then I'm speaking veterinary language when I'm dealing with the veterinary professionals, and a bit of a translator sometimes. So if we're able to bring them together through using some of these types of sort of framework, we can then hopefully develop multidisciplinary policy. And this can then lead to developing preventative support preventions and happy people equal happy pets. And also through, if we're able to integrate and show what we're able to provide our human health services, hopefully we'll be able to start tapping into some of that money that the human health services have, because there's not that much for us at the moment. So just quickly, so that's been the first round of my PhD. So now we're looking at my current study. We're looking at exploring the association between social determinants of health and animal relinquishment, and I've been very privileged by our 4 partners to be given a substantial amount of data. So Second Chance Animal Rescue in Victoria, RSPCA in Queensland, New South Wales and Victoria have generously supplied this information. So we're going to link that back to the social determinants and the social economic status proxy that's done by the census. And then we'll hopefully then go on to exploring how these social determinants of health related challenges of companion animal guardianship are within Australia through both using surveys and interviews, with the overall goal to create a program to implement and test, which will hopefully help us move forward and reduce the relinquishment of pets to shelters. So I'd just like to say a huge thank you for having me today, and also to if anyone's interested in doing any collaborations or wanting to talk to us or working together going forward, we would be very interested in hearing from you. So my contact details are just up there, and thank you very much.
So now you can stay up here because we'll invite our presenters. Thank you so much, Sonya. You said that you were quite nervous about making that presentation, but no one would have ever known. That was just fantastic. I'd like to invite our presenters from this session up to the desk up here for a quick Q&A session. Fantastic. All right, we better get stuck into the questions. We've only got a couple of minutes. The first one is for Vincent from Samantha. Do you think there will ever be an opportunity for Haas or Maddie's Fund to expand assistance to Australian-based organisations and projects?
I
think it was on.
It was on? So we definitely are very interested in working with any one of the shelters here. And providing you with some resources and support. And we get requests all the time. And so, yeah, we definitely feel like that's something that is a possibility for the future. And even as we expand our project to actually invite international shelters into our actual pilot project programs.
Thanks, Vincent. Question for Jennifer from Emma. Do you operate in Adelaide only, or do you service other states in Australia?
So we have done some interstate requests in the past. We've actually got a few foster carers in Queensland, but we aren't as resourced as we are. So we do generally try and stick to SA only, but we want to become national. But yeah, so it's we get some requests, like some high DV cases. Sometimes some Adelaide people will actually move interstate, or people from interstate will come to Adelaide, and that's usually the DV services that are connecting that and requesting a service. But yeah, basically just SA.
Thank you, Jennifer. A question for Anne Margaret from Marissa. What advice do you have for an organisation who wants to work out their social return on investment? Where does one even start, or are there companies that could help get started? It sounded very complicated.
Just make sure you've got all your data to start. And, I mean, you can Google SROI and you'll find many consultants that will actually do it for you. So it doesn't come cheaply, but I think that the impact of getting those numbers just to show your story, what you can do and use it for advocacy is so important. So as I say, we were very lucky to have a staff member, but yeah, there are many consultants that will do it. I can't recommend anyone, but I would look around. You can do a course yourself. We all did a course before we actually undertook it to actually understand what it all meant, but I certainly myself wouldn't have launched into trying to do it. So you need to get someone who professionally knows how to do it.
Thanks, Anne Margaret. And finally, a question for Sonya. This is from Melissa. Where do you see your work going?
Good question. I'm only halfway through my PhD, so I'm not 100% sure, but I definitely see it as some sort of postdoc, hopefully, that I get to do some work with organisations to help them develop programs to provide that preventative message, but also to provide that support to have those conversations with the key stakeholders, especially I find even when I have conversations with our political partners, we've got to do that translation across both human and veterinary to be able to show them the worth of the amazing work that we all do.
Fantastic. A big thank you to all our presenters from this morning.